pregnant woman with a higher income can get onto Medicaid than a non-pregnant woman.
Okay.
And that was something that Congress did in the 1980s, actually. It boosted eligibility levels for pregnancy-related care under Medicaid in response to some very serious concerns back then about levels of infant mortality in this country and the large numbers of pregnant women who had no prenatal care, had no source of insurance, and were just showing up in, at the hospital 9 months pregnant and giving birth, and without having gotten the prenatal care that they needed. So Congress went in and greatly boosted up income eligibility levels under Medicaid for pregnancy-related care. Starting in the mid-1990s, a couple of states said, this is making no sense whatsoever. This makes no sense to have these different eligibility levels. So a couple of states went to the federal government and asked for permission to experiment, because that's the way you can essentially break the Medicaid rules and try something, with setting the income seal, with raising the income ceiling for family planning in the states up to the level where it is for pregnant women. Which, and New York, we now have 21 states that have done that. New York is one of them. And, it makes a huge amount of sense. It has, the governor of New York, Governor Patterson, essentially saying to the women of New York, okay, fine, you want to get pregnant, the state of New York is here for you. I'll give you the prenatal care that you need to, for your health and, to ensure a healthy pregnant birth outcome. Oh, you don't want to get pregnant. The state of New York is here for you as well. It really levels that playing field and is very powerful. And so go ahead.
Well, I'm just thinking, I can't guarantee you that that every single person watching this show is comfortable with family planning. So how can you justify that everybody's tax dollars must go to subsidize somebody else's family planning services?
Well, it's a very good question, although I think the discomfort with contraception is probably less than we in fact might think. According to the Federal Centers for Disease Control, 98% of American women use contraception at some point during their lives, and they in fact describe contraceptive use in this country as virtually universal. I think over the last several years, family planning, the politics of family planning have gotten all tangled up with the politics of abortion. And I think that has been most unfortunate. I think it has led to reduced funding for family planning. And I think it has set us all back greatly in our efforts to provide contraceptive services to low-income women in need. But let's look back at what some of these programs have been able to accomplish, because I think it speaks to why there's such significant public support for these programs. There are now 21 of these programs in states across the country, and yes, we have New York and California and Oregon, but we have Texas and Louisiana and Virginia and Mississippi and Oklahoma and Arkansas. We have the newest of these programs is in Missouri. So they are, gaining popularity in places where you wouldn't really expect a groundswell of support for family planning. But I think the results that these programs have been able to show for themselves, really make their own case. They expand access to family planning. By expanding access to family planning, they're helping women avoid unintended pregnancy, and that is the best, clearest way that we know to reduce abortion in this country and by reducing the need for abortion in this country. These programs improve maternal and child health. It is very clear that having too many babies too close together is not good for the mom, and it's not good for the baby. Very closely spaced births is a known risk factor for low birth weight, which is a clear risk factor for infant mortality, which is why the National Governors Association views these programs as an important step that states can take to improve maternal and child health. The March of Dimes has weighed in with a kind of a very related argument, saying that, remember we said before that 60% of the women who go to family planning centers view that center as their usual source of care? By getting women into the healthcare system, hooking them into the healthcare system, getting them a relationship with a healthcare provider before they become pregnant, the March of Dimes believes is critical to getting them into prenatal care early and quickly when they do decide to become pregnant. And that's why the March of Dimes, for example, is supporting these programs. So we're expanding access to services, we're reducing the need for abortion, we're improving maternal and child health, and we're doing all of that, in fact, by generating significant savings for the states and the federal government. It's not rocket science that providing family planning services is significantly less expensive than providing Medicaid-funded pregnancy-related care. And if you can get those income ceilings at the same place so that the women you're providing family planning to are those women for whom you would be providing Medicaid-funded pregnancy-related care, the closer you get those two income ceilings, the more cost-effective these programs are going to be. And we know that nationwide, every dollar spent to provide publicly funded family planning saves $4 in Medicaid costs that otherwise would be spent for pregnancy-related care and for infant care. So I think there are, fabulous reasons why these programs are, worthy of support, and in fact that explain why they're getting support, not only from people like me, but in, the kinds of places where they are getting support.
So Rachel, that said, when you look at the current political scene, what keeps you up at night?
Oh, that's such a good question. I think it's wanting to pull family planning back from the politics of abortion and to have family planning looked at as family planning, as the critical basic health care that it is. Many years ago, a colleague of mine were sitting in a prenatal care clinic in Mississippi, in rural Mississippi, and talking to the prenatal care nurses. And all they wanted to talk about was family planning, because they viewed family planning as a healthcare service. And the two of us were from Washington, D.C., and we had gotten into this Washington mentality of viewing family planning not as healthcare, but as politics. And at this moment, as we are moving into healthcare reform, I think we have to put family planning back on the map as the critical basic healthcare service that it is, as we said in our report, as smart government at its best, and to have it looked at in that context as we go into this overall effort to recast our entire healthcare system. That as we go into that, family planning needs to be viewed not only as healthcare, but as critical basic healthcare for women. We need to make sure that it is included in all the, that it is covered adequately and reimbursed for in all of the purchasing requirements and all of the systems that are set up, and that we address low-income and disadvantaged women's needs for family planning in whatever the public component of the system is that will emerge from all of this, hopefully very soon. I think your homework for each of us in our own lives is to do our own part to start thinking of family planning as a healthcare service and not a political issue and not a political football. That it really is care that women depend on, care that women need, care that makes a huge amount of sense, for all of us, care that is important in any times, is fundamental to, the ability of women to, stay in school, get an education, complete an education, get a job, keep a job. All of those things that are absolutely critical at any point that have frankly taken on such a special urgency during these difficult economic times, and to view family planning as making the critical contribution that it in fact makes. After this program is over, where can we go? We can go to the, for further information, to the Future Choices website. But where else? You can also get all of this information on the Guttmacher Institute website, which is www.guttmacher.org. And if you go there, you can sign up for a multitude of different listservs that will not only, so that you can keep up with the sorts of information that we are putting out. Excellent. Well, Rachel, I do want to thank you very much. In the coming months, we are likely to hear a good bit about family planning legislation both in D.C. and in Albany. We're also likely to hear a lot of disinformation. So, dear friends and neighbors, I hope that you will remember the wisdom that Guttmacher and Rachel Benson Gold have bestowed on us today. When you are evaluating these news reports, let's ensure that every woman enjoys real choices about her future.